The White House declared the opioid crisis a public health emergency in 2017. Murrow News 8 reporter Lindsay Jensen has more on how Pullman continues to treat the crisis today.
Americans are now more likely to die from an opioid overdose than a vehicle accident. From 1999 to 2017, almost 400,000 Americans have died from an opioid-related overdose. Through the Opioid Overdose Prevention in States program, 45 states are provided strategies to improve safe opioid prescribing practices. Pullman Regional Hospital is now carrying a new surgical procedure as an alternative to opioid prescriptions called Cooley, the first and only radiofrequency treatment to relieve chronic pain for up to 12 months.
Anesthesia traditionally used opioids as a main portion of an anesthetic, and we're moving away from that. We're moving away from that being the main analgesic for anesthesia. And pharmaceutical companies, as well as investigators in medicine, will continue to develop more and more non-opioid pain adjuncts to help fight this opioid crisis.
The WSU Pullman Pharmacy program moved to the Spokane campus in 2013. The Washington State Department of Health donated almost $90,000 to provide WSU Spokane training sessions to those pre-med students with a new curriculum and facilities to recognize opioid addiction in patients.
I don't think we have any of the courses that come close to covering pharmacology, but there should be, because we are a drug-oriented society and people need to know more about drugs. Not just drug abuse, but drugs in general.
With this national epidemic, pre-med students at WSU can take an elective class that focuses on the ethics, financial, and personal aspects of medical practices.
Before this research project, I knew it was a problem, but I did not realize how much of an impact that it has had in our society, and it is something that needs to be forced to learn so that they are aware of the situation.
There have been multiple successes in decreasing opioid prescriptions up to 85% from 2010 to 2015, such as Florida, Ohio, and Kentucky. The Center of Disease Control and Prevention wants to provide more surveillance activities to address those states' ever-changing needs. Lindsay Jensen, Murrow News 8.